Let me say that, first of all, I went to see the Nutcracker on Saturday night, and there was a great conductor of the orchestra. Tim Keene ended up sitting right in the row right behind us. We couldn't believe it. You can be a conductor, but if you don't have the people to play the music, it doesn't amount to anything. Tim Keene, invaluable in this process. And don't forget, we have about $250 million in the rainy day fund, and we're running an overage right now in the budget, which is called for in the statute, and we are running ahead of revenues. We're not going to pound our chest too hard, because this national economy, Europe, and what happens in Washington, who knows about next week. But for now, we feel pretty good, and we've been given the credit of an increased credit outlook, which sends a message across the country. One of the other things that was important is you just don't crush people that can easily be ignored, and we'll get to, and don't let me leave here without having John Martin and Tracy Plouk say something about mental health and developmental disabilities. We were not going to run over people. It's just not in our nature. Greg Moody, whose wife happens to be a preacher, didn't know whether he wanted to come to the administration. His wife said, "You have a heart for it and you're going." The Medicaid reforms have now become something that the entire country is looking to copy. I don't need to tell you about the political fight over the ability to have mom and dad stay at home rather than go to a nursing home. 1/5 of the cost of being at home, where you're more independent, healthier, happier, instead of being put in a nursing home, while preserving the need for nursing homes because they're necessary. But they shouldn't be used when they don't need to be used. And you talk to your mother and father, your grandparents, they'll all tell you, God, if I could just stay at home. This was something that had been worked on for 30 years. I don't know how many more studies, reports. Didn't take another study or another report. It just took a little determination. We were able to get that done. It would have been easy to save some money, wouldn't it, Greg, to have denied children dental coverage? Well, that's an easy one. Just cut off their dental coverage. Well, where does that get you? So we decided to take a look at the 4 or 50% of the 5% of the Medicaid population and be able to get them over time in a setting where they're going to be more comfortable. You know, it's sort of similar to the medical home that Dr. Winslow is a pioneer of. Manage them so they get better quality care. They should not get their primary care in an emergency room. And Greg put together an incredible program, including the integration of mental and physical health, another controversial item. And we have now been able, well, Greg's being praised by those in that community because of the sensitivity. Praised by the AARP for his home and community health philosophy. Praised by the mental health advocates, am I right, Tracy, for the integration of mental and physical care. And that is where we are today. But I want you to understand that Greg is heading into Medicaid 2.0. And Medicaid 2.0 is the ability to be able to drive the dollars of Medicaid with private sector improvements. This is one of the to-dos that we will get into a little bit later. But we just, for example, we're down with General Electric, which is an awesome company here in the state of Ohio. And we are going to align our Medicaid dollars with the reformers in Cincinnati to drive outcome-based medicine, not quantity-based medicine, where you get as many in there and you charge them by the unit as opposed to paying people on the basis of outcomes. This is where we want to go. It's where we want our families to be. We want to pay physicians, healthcare providers to keep us healthy, not get them to be paid on the basis of how many sick people they treat. Now, this is a transformation of the system. And Greg Moody is he's the author, and he has a great team along with John McCarthy, who moved his family here from Washington, D.C. I don't see McCarthy. Is he here today? There, he's a great man, brilliant man. And Greg, stand up and say a few things about what you were able to achieve. Be shorter than the governor, though.
Well, I appreciate the personal comments. departments, but of course, you know, we all did this together, and not just our team, but also with the legislature and with stakeholders. We were in this interesting situation where we had this natural coalition where what consumers said they wanted and greater stewardship of taxpayer dollars were actually the same thing. Being able to be cared for in a home and community-based setting instead of an institution is what people wanted, and it's less expensive. The challenge was to providers, because really we said we can't do it this way anymore, we have to do it a different way. And that was challenging to folks. Hospital providers, physician providers, folks really stepped up and said, we get this as a bad budget, we get that we just can't cut our way out of this, let's work together to figure out where we're going for the future. And that combination, consumers and taxpayer interest challenging providers, and honestly challenging us to do better with our government systems, that was the combination that made it really an obvious choice politically for the legislature and for us. Like the governor said, we're just getting started. We had to focus first on Medicaid modernization, but we're already starting to look at how to streamline other health and human services, basically get our house in order to do better, share services, and then really align our purchasing power with the private sector so we have aligned expectations for improved health outcomes.
John, anything you want to say? You work really hard. Why don't you come and say, let me tell you, we're in the business of doing an entire new way of procurement, which you will hear a lot about. It's going to shake things up again, but it is a system designed to offer communities more choice, we hope better pricing, and better quality. John?
I mean, just to add to what Greg said, it was looking at this program where it was and where we needed to go. We really focused on what is best for the individual in the program. As the governor was talking about, it would have been easy for us to go and look at optional services, cut optional services, but that wasn't the way we wanted to do this. We wanted to say, how can we do this to drive costs down and improve quality? And that's what we're focused on, is how do we get quality up? We're looking at different ways to do this, innovative ways to do this, ways that haven't been done like this before in other states. And so we really want to take the lead. We're really excited about this idea of partnering with the private sector to figure out how do we get outcomes-based health care in Ohio.
And again, I want you all to know that when you talk about this, you're talking about taking services away from poor people to give you an accumulation of dollars that in the short run might make your budget look better, but in the long run doesn't change the system, and frankly, is cruel. But we're just not going to do that. And I want to pay a particular amount of credit to the providers and the members of the legislature. There was a bet as to whether the nursing home lobby could be resisted. It's an everyday fight, folks. I saw one of them the other day. I said, we're not giving you any more money now. Don't get caught with your, get embarrassed, get egg on your face. You see I'm cleaning up my language. But anyway, there's a long way to go on this, but the need to have fundamental transformation of our healthcare system is there. We were told at GE that their year-over-year costs actually have declined, which is amazing, and quality has gone up, and it's best for sure with those people who are the recipients. Long way to go on Medicaid, but very exciting. Here's one that gets all the Republican faithful up on their feet cheering. Sentencing reform. They really get pumped up about this one. Taking our nonviolent offenders and not institutionalizing them and getting an outcome that basically can destroy their lives forever. We are so lucky to have Gary Moore. The warden for a long time, Corrections Corporation of America, seeing both sides. And this guy's got a heart like you wouldn't believe. I think last year he said we put 12,000 nonviolent offenders in prison for less than 1 year, put them next to drug traffickers, theoretically, murderers, rapists, release them unsupervised in the community, and talk about what a great job we did. The pendulum has swung back. You just don't lock everybody up. It's just not right. And we received a beautiful blog from Chuck Colson, who said that he found his life once he went to prison, dedicated his life to serving the Lord, created the Prison Fellowship Ministries, He's a big supporter of what Gary Moore has done. Now we are moving to segregate those who are most violent from those who are not. We are working to segregate the gangs from those who want to be constructive and get their lives back. He works very closely with our youth services operation. Gary also is involved in step 2, step 3, step 4 is always another step, and that is eliminating collateral sanctions. Now, we convened a meeting, unbeknownst to all of you, with people who wanted to pass out a get-out-of-jail-free card, philosophically, with those who want to lock them up forever. And we got them in a room to talk about collateral sanctions. We don't believe that somebody who's 26 years old, who may have received stolen property in a very dumb moment in their lives, should be basically have their whole future taken away by not even being able to do simple things like drive a truck or cut hair. Gary's got big plans. Gary's becoming a national figure. He is invited to every national conference, and we only waited 30 years to improve this whole sentencing system, and I'm thrilled with what we've done. I want to give a lot of compliments to the Democrats and to the conservative Republicans for doing these first steps together.